Hello, my name is Alana Herbst, and I'm from the Child's Play, Learning and Development Lab at the University of Delaware. Today, I will be talking about the Quick Interactive Language Screener, also known as the QUILS, and how the QUILS can be used to assess language skills in 2-year-olds, young English reared children, and Spanish English bilingual children. But first, why is language so important? Well, we know from research that language is foundational to all areas of human development and education, and that language skill in preschool predicts later reading and academic achievement. Language also helps us capture knowledge and acquire concepts. Finally, language helps us engage in self-regulation and executive function. We also know that language disorders affect between 6 and 15% of children, and that many of these delays go undiagnosed until children are formally tested upon kindergarten entry. However, if we could test children earlier, identify their language delays, and intervene, this could potentially alter future outcomes for children with language delays. This is where the QUILS comes in.
The QUILS is a touchscreen language test that is automatically administered and scored by a computer or tablet.
It provides a comprehensive profile of children's language skills. It assesses vocabulary, which are the words that children already know, grammar, which are the syntactic structures that children can comprehend in sentences, and process, which are the strategies that children can use to learn new language items. This allows for early identification of potential language delays. There are 3 different QUILS screeners. First, we have the original QUILS, which is for monolingual English-speaking children, 3 through 6 years old. We also have the QUILS ES for English-Spanish bilingual children, 3 to 5 years old. Finally, we have the BabyQUILS for monolingual English-speaking children who are 2 years old. Each screener works in the same way, although the items are different. To give you an idea of what this looks like, I'm going to play a short video.
We created a
When I say
computerized, culture-free
find the
language
teacher.
screener that can be given in 15 to 20 minutes by an aide or a teacher to children between the ages of 3 and 5.
Find the girl behind a car in a white garage.
The computer asks the questions and the child touches the screen to record their responses. Children enjoy taking it and ask to do it again.
A murph is a kind of bird. Show me the murph.
The computer stores the children's responses and derives an overall score based on the child's age. In addition to the overall score, this screener gives us component scores in 3 areas. Syntax: can children understand questions such as where, when, and how? Vocabulary: what words do children already know? And process: how good are children at learning new language items?
Each of the screeners were developed in a laborious process and were based in the latest research on language development. The original QUILS screener started with 96 items, and over 2-item tryouts this was culled down to a screener with 48 items. Norms were tested on over 600 children from across the United States. The sample was diverse in terms of socioeconomic status, as measured by primary caregivers' highest level of education, and was also racially and ethnically diverse in a way that reflected the U.S. population. In order to determine which of the original 96 items should remain in the final screener, a few statistical analyses were used. Roche models were used to assess item properties independently of the sample used to estimate them. This model gives a misfit score, which indicates how consistent each item is with the model's predictions. Redundant items, or items of equivalent difficulty, can be identified. Differential item functioning can identify measurement bias. This test assesses whether different groups, for example males compared to females, perform differently on an individual item while controlling for overall performance. Results showed that all QUILS screeners have high validity when compared to existing tests. They also have high internal reliability and high test-retest reliability.
The QUILS ES is a culturally and dialectically neutral screener that assesses language skills in both English and Spanish. This is done through 2 separate 45-item tests, which are each 15 minutes long. Items on both sections were independently derived and include the same syntactic structures in both languages. The QUILS ES is not a simple translation of the English tests. Items on the QUILS ES were carefully selected to avoid cognates.
Here are some sample items from the QUILS ES. A vocabulary item, a syntax item, and a process item.
Finally, we also have BabyQUILS, which is for monolingual English speakers who are 2 years old. We know that intervention is most effective the earlier it's done. So to intervene earlier, we need earlier screening. And that is what the BabyQUILS was designed to do.
The BabyQUILS assesses the language skills of monolingual English-speaking children aged 24 through 36 months. The screener engages children with sounds after each item and animations between sections, and incorporated drag items to make it more hands-on, and red circles to guide the children towards pressing the screen. Even though 2-year-olds are notoriously difficult participants, 96% of children completed the screener, so these children seem to really like it. Here are some sample items from the BabyQUILS: a vocabulary item, a syntax item, and a process item. In summary, the QUILS tests are reliable and valid against other instruments. Unlike other tests, the QUILS does not require a skilled examiner. It is automatically administered and scored from a computer or tablet. The screener also presents a detailed, easy-to-read report for families and educators. The QUILS tests vocabulary, syntax, and process for a more comprehensive measure of children's language ability than other tests. This QUILS can be used to quickly and easily identify children who are at risk for a language delay. As a screener, the QUILS cannot give a precise diagnosis, but it can give a red flag for further workup and follow-up by a professional.